Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order, and definitely this is quite convenient for the continuous study. My dear friends, as we have been discussing about newborn care, today we'll go ahead with the part number 11. Now today we will discuss one of the Navajata Shishu Paricharya procedure which is mentioned in our science, Ayurveda, so that is Garbhodaka Vamana. This Garbhodaka Vamana is nothing but present today's scenario. It is nothing but the stomach wash. How and why we shall see now. Now, Garbhodaka Vamana is indicated as one of the procedure immediately after birth. The reason is very simple. During the fetal life, usually fetus aspirate or swallow some amount of the amniotic fluid, and this usually happens during the last part of the delivery and where the vigorous uterine contraction begin. Now we know that the fetus is actually floating in the amniotic fluid. In the process, it also consumes some amount of the amniotic fluid, which was later converted into urine, and as urine it again passed back into the amniotic fluid. So this process is always going on. The same process will going to increase to some extent during the last portion of the fetal life, or when contractions happens. There may be vigorous movement and that may lead to more consumption of the amniotic fluid. However, amniotic fluid is safe, no problem, if it is not stained with the meconium. Usually amniotic fluid is clear, hence does not cause any danger. But if the amniotic fluid is mixed with the meconium, it may be thick meconium or it may be thin meconium. If the baby also passes the meconium inside the uterus and that meconium mixes with the amniotic fluid and baby consumes that amniotic fluid, and there may be chances of one is that meconium mixed amniotic fluid may enter inside the stomach and cause the meconium gastritis there. And if the same is when consuming, if it is get aspirated into the trachea, and it can cause blockage of the trachea, which leads to meconium aspiration syndrome after birth. Nevertheless, even in the normal conditions, that is even in the normal delivery also, a clear amniotic fluid from the stomach has to be removed to avoid the risk of aspiration into the lungs sometime, and also meconium gastritis. So procedure of stomach wash is done in routine practice, especially those normal babies delivered by LSCS. Now cesarean section, when you deliver, baby is just picked up and then it is taken out. But in the normal delivery, baby has to pass through a narrow passage of the vagina and all, so baby will be somewhat squeezed. So amniotic fluid which is present in the stomach, most of the time it comes out. But this will not happen in the LSCS. In the LSCS, we have to go for stomach wash to remove the amniotic fluid present in the stomach. This may not be the case in all the normal deliveries. In the normal deliveries, usually baby passes through the narrow vaginal canal so that it is moving, and during that movement compression takes place, and there is also pressure over the stomach area, and much of the amniotic fluid comes out. Therefore, cleaning of the oral cavity is very, very important immediately after the birth. However, nowadays we use a safe method for the Garbhodaka Vamana, that is stomach wash. That is, we use a nasogastric tube of 5 number or 6 number or sometimes 7 number, depending upon the gestational age of the baby. So how to do this? Holding the baby at the shoulder level. You have to hold the baby at the shoulder level with a semi-flexion position of the neck, and slowly introduce the nasogastric tube through the nasal cavity till there is a black mark. The black mark of the tube reaches the nasal LA level. Check the presence of the tube in the stomach by pushing air through the tube by a syringe, and subsequently keep the stethoscope over the abdominal area to hear the gushing sound of the air. If you get a gushing sound, that suggests that tube was safely placed in the stomach, and now you can go for removing of amniotic fluid through this tube. Now slowly with the negative pressure remove the stomach contents and estimate the amount of the fluid which is removed. Then push the normal saline. Once you remove all the amniotic fluid out, then you push some amount of the 5 ml of the normal saline, and you have a wash of the stomach, clean the stomach and again aspirate so that any chemicals which are sticked there, so they will be taken out to avoid the meconium gastritis. Now after all the procedure done, slowly remove the tube by sustaining the negative pressure in the syringe. The end of the tube which is placed in the stomach, it contains two small holes through which the gastric contents comes out. But when after completion of all the procedure, when you are removing it, just give the negative pressure. Why? Because the tip of the tube is there in the stomach and the acidic contents will be there. So if that acidic substance are stick to the tip of the tube, when you are removing, what can happen is it can go on staining all the GIT tract, esophagus, etc. By the acid, and it may lead to some corrosive action. So to avoid that, to avoid the contact of acidic contents with the rest of the mucous membrane and all of the GIT, so just give the negative pressure and just remove the tube. Although in normal delivery, amniotic fluid will be squeezed out, as I told earlier, while the fetus is passing through the narrow vaginal canal, but in LSCS, definitely the stomach wash is compulsory. Now coming to the other fact that Ayurveda also explains this method with slight modification. What Ayurveda says is, after performing the routine procedure like cutting of the umbilical cord, etc., then you have to take two substances, that is Saindava and as well as Grita, and they are mixed together. Or you can also add some of the Vamanopaga drugs like Vacha is kept over the mouth of the baby and made to swallow, so which will be followed by the mechanical stimulation of the throat by a clean finger tip. Now this is the procedure given. You have to take Saindava and Sarpi. Okay, and you can also keep some of the Vamanopagat like Vacha or maybe even Yashti Madhu in the mouth area, so that, and then you just see, first you have to take the Saindava and Sarpi. Saindava is nothing but sodium chloride, which is an antiseptic solution, and it has got Vishandanakara property. It breaks the mucus plug, clean, liquefies. And Grita is there to give the nourishing effect and as well as lubrication and moisturizing effect. Okay, so that will be applied over the oral cavity area, and then you have to touch the throat of the baby by keeping the baby in a safe position to induce the vomiting. Okay, so this was the method which is followed by Ayurveda for the Shishu Chardana or Garbhodaka Vamana. This method may looks a little rough method. Okay, rough method. So nowadays we are shifting it to the safer method like stomach wash. In the stomach wash also the concept is same. In the Garbhodaka Vamana mentioned by Ayurveda also the concept is same, and even the sodium chloride is also used by the modern science, and here also we are using Saindava, which is nothing but the liquid solid form, which is nothing but solid form of the sodium chloride. So inducing Vamana or Chardi has been mentioned even for a newborn child. Of course, this is now nowhere related with the Vamana procedure conducted in the Panchakarma treatment. Many times the confusions are there. In Shishu also we are giving Vamana, so Vamana can be given in Shishu, Panchakarma is indicated. No, this particular Vamana is not the classical Vamana. Although it is mentioned Shishu Chardhayet, although it is mentioned as Chardana, it is not a classical Vamana, isn't it? There is no Snehapana, there is no Deepanapachana Aushadhis are given, or Akhanta Pana is not done. It's not like that. So this may be taken as one of the form of the Sadhya Vamana. Okay, Sadhya Vamana. So mechanical induction of the Vamana may be dangerous at times due to the risk of aspiration by the baby. Hence, same has been substituted by stomach wash nowadays. Normal saline used for the stomach wash is used by the modern science also. It is nothing but Saindava, as I mentioned. Now, Garbhodaka Avamana, if it is not done, if Garbhodaka is mixed with the meconium and that Avamana is not done, that is not removed, it may lead to a disease called as Ulbaka Roga, which is mentioned by Ashtanga Sangraha. Okay, this is all about the stomach wash. Stomach wash basically act by the siphon action method. Okay, just to give the negative pressure, just give the pressure, then by itself the contents of the stomach will come out. So it's called as siphon action. Okay, so this is how Ayurveda clearly mentioned the concept of a stomach wash. But as the older method is a little looks like a crude method, so we are now following most sophisticated and as well as risk-free method of a stomach wash. Of course, the principles remain same, concept remain same. Thank you very much. In the next class again we will discuss about one more important procedure, that is Raksha Karma in the newborn care. Thank you very much.